Thank you. It's such a pleasure to be speaking at today's event. It's been a really impressive day of speakers, and it's a bit daunting to be amongst the last on this panel, on this very distinguished panel. And I sincerely appreciate the organisers for the invitation to speak today, and I would like to pay my personal respects to the owners of the traditional land on which we gather today and acknowledge their traditional owners past, present and future. I think I was asked today because I was very fortunate in being able to launch a book that I wrote earlier this year called Contagion, which was looking at the politics of disease outbreak, surveillance and response in Southeast Asia during a crucial decade, the outbreak of the severe acute respiratory syndrome in 2003, up to the outbreak of the West Africa Ebola outbreak in 2014, which thankfully didn't make its way across to this region. But what I looked at over that roughly decade was the extreme effort to try and organise regional cooperation, in particular amongst the Association of Southeast Asian Nations, who had membership across the World Health Organization, the regional offices, and 2 different regional offices, and the role that the Australian government had played in being one of a number of international conduits and supporters of that type of health diplomacy that was really a key focus during that decade, in a region where there has been sometimes resistance or different interpretations of the importance of international regulations around areas such as promptly reporting disease outbreaks, transparently reporting where they're occurring, communicating across with neighbours about suspected outbreaks, and if they're unable to detect or verify what that outbreak is, seeking assistance to try and do so. And what I argue in that book is that that was not by accident. That was by a very deliberate design, a very deliberate diplomatic design to try and foster cooperation, to try and foster a sense of collective interest. And I think given the conversation today has been around where is their agency, what issues are we facing in the future in terms of trust, and how do we think about those future challenges and what works in response to what's ahead, I'd like to focus a little bit on those in light of the conversation that we've had today, and in particular where I think there's future room for thinking, in particular in the area of health diplomacy. So I'm going to put my cards on the table straight away and say that I come at this as a functionalist, knowing that there is a certain amount of problems with the way that theory has developed over time. But what does that mean? I think it points to what Nigel's been talking about, which is the importance of thinking about cooperation in non-political contexts, and in particular, thinking about the importance of cooperation across countries in moments when there is contention, where there is a sense of heightened risk, where there is perhaps distrust in what we would see as our traditional institutions, our traditional rules. Actually looking across and thinking where is there opportunities for collective governance, and perhaps sometimes what is seen as limited functional, technical and economic areas is actually really vital, because what it often can do is capture those everyday human needs. Think about what is causing everyday insecurity, and that can be a really important entry point into building future diplomatic trust and cooperation. I think health diplomacy captures this approach. It's not done with a sense of blind optimism. There is much knowledge, and as I document in that decade of looking at cooperation in this region, there's an acknowledgement that sometimes things still don't get reported, sometimes people don't want to acknowledge what's happening, but there's also really important moments where through that constant effort to ensure that there is face-to-face meetings, that there is this elevation of health diplomacy to the highest levels in government meetings and regional meetings, there is a person to speak to on the other end of the line when you're facing a situation and you don't quite know how to negotiate your way next and forward. I think it's really important that we think about the deliberate agency that is invested into trying to think about how to use knowledge, expertise to improve the human conditions. As we've heard from this panel already, there are a number of really significant challenges that we all face, and dedicating political effort and diplomatic time and money, which we've heard from Melissa Conley-Tyler today in her report, DFAT, is facing quite a significant struggle, but I think it's really important to think and acknowledge about where we diplomatically can have real power and agency. And I think in these sorts of functional areas, we have a really important role to play at the moment. The first area where I think it's really important to think about success or the potential for success, where we could be doing more, is the Indo-Pacific Centre for Health Security. I think the announcement of this centre was a really significant move, not because it actually delivered more money, it didn't, it was a shift of money, but what it was an ambitious political statement about, in the environment where the aid budget is shrinking, there was diplomatic ambition to try and think about where there's opportunity for greater politics and diplomacy in the region around an area that is of significant importance to this region. As Penny was saying, we are seeing rapid urbanisation occurring in our region. With rapid urbanisation comes the risk of more poverty traps. With rapid urbanisation in an environment where our climate is significantly changing, we are seeing health outbreaks and disease outbreaks, particularly mosquito-borne diseases, really are going to have a massive impact on the way in which populations organise, the way in which they access water, sanitation. And there is real opportunities here, amongst all this real risk, to think about how we can diplomatically cooperate. That's why I think that in the area of multilateral exchanges, it was disappointing to me this morning to hear not more discussion about our key partners in the area of health diplomacy. We have long advocates such as Indonesia, Thailand, Singapore, and even China in these areas, where there has been over a decade of hard work done to try and think with South Korea and the United States, as well as Canada and Norway, how we can collectively think about improving our regional and global health security. And I would like to see more discussion about how this can be done through areas such as exchanges in the areas of universal healthcare coverage, which we know from last month has been identified as a key platform moving forward. Our region has a lot of work to be doing in terms of influenza vaccine production, which is an exchange, which is an important area to focus on if we're thinking in peacetime, where is an area where we can think about vaccination production, distribution, risk communication with public-private partnerships, in an environment where we're not yet under the type of threat that we would be during a disease outbreak. I also think we could be much more ambitious in the way we're thinking about our fellowships and our partnerships in an education level. It's wonderful to see the ASEAN Australia Health Security Fellowships, the Health Silk Road by comparison, and the ASEAN China 100 program is outranking us by about 10 times that amount at the moment. So I think we could be doing a lot more in that space as well. The second reason why I think this is really important is because while I've been talking optimistically about what we can do, I think we also need to be really cognizant of the fact that politically and operationally in our region, trust and communication is something that shouldn't be taken for granted. Pitchmon was really interesting this morning when she was talking about civil societies and the pushback they're sometimes experiencing in the region and this delicate balance at the moment in the way some of those countries are going through their political transition. I think what we have to be aware of, and that's something that I think is quite different to what I was seeing when I wrote the book, is the way in which trust and communication in the last decade has radically changed in ways that lean more towards at the moment for there to be controls on information, for there to be shutdowns on communications by states, which could actually undermine sometimes important health messages and trust, in particular in our civil society sector and the access to information that they are able to have, who we often rely on in a lot of disease outbreak events and in peacetime disease control. So thinking more carefully about how we can bring civil society sector into our health diplomacy discussions is really important, as well as bringing in our educational institutions, as well as thinking about not just the high-level political operatives, but also those mid-level and senior-level bureaucracy as well, who often have to manage those early moments of trying to think about how to navigate and cooperate in a disease outbreak emergency.
Sarah?
Finally. Finally, I was asked to talk about gender, which I won't have time to talk about. It was my fourth, but I'll do my third one and it will come in through there. I think we need to think about the fantastic rules-based institutional approaches we already have in place. There's been a lot of discussion recently about them being fragile, them being not working. I think we need to think about what the world looked like before the smallpox eradication and the effort that went into that. The Global Alliance for Vaccine Immunisation, the Global Fund to Fight HIV, TB and Malaria, the fact that we're now talking about a universal healthcare declaration, something that we aspire all countries to be trying to reach by 2030. The international health regulations and the discussions and the heated debate about whether or not that regulation should have led to declaring a public health emergency in the recent Ebola outbreak in the Democratic Republic of Congo. None of these institutions or funding arrangements are perfect, but a world without them, where they didn't exist, would be terribly grim indeed. And I think it's really important that we think more about the gains that we have made through very hard efforts to think about these areas as not just technical enterprises, but also really important diplomatic areas of exchange and cooperation that we invest in.